Welcome to this video, where we are going to address a topic of extreme importance to men's health: prostate cancer. This is a subject that may also interest women, especially in the context of couples or relationships, since any illness also affects those we live with. Prostate cancer is one of the most common types of cancer among men, making it a global concern. Today, we will better understand this disease, how to detect it early, and what measures can be taken to reduce the risk. But remember, this video is no substitute for a medical consultation. Let's get started. Around the world, prostate cancer is one of the leading causes of death among men. According to the World Health Organization, more than 1.4 million new cases are diagnosed annually. This alarming number highlights the importance of awareness and prevention. Developed countries have higher incidence rates, which can be attributed to better diagnostic methods and longer life expectancy. Prostate cancer is a public health concern worldwide, but its incidence varies significantly across different regions. Let's take a closer look at some numbers. In the United States, prostate cancer is the second most common type of cancer among men after non-melanoma skin cancer. According to the National Cancer Institute, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. In 2023, it is estimated that more than 248,000 new cases were diagnosed, and about 34,000 men died from the disease. The high incidence in the United States is partly attributed to the widespread availability of screening tests, such as PSA, which allows for early detection of the disease. In Europe, the incidence of prostate cancer is also high, particularly in northern and western countries like Sweden, Norway, and Finland. Sweden, for example, has one of the highest incidence rates in the world, with about 200 new cases per 100,000 men per year. In contrast, southern European countries, such as Greece and Italy, tend to have lower, though still significant rates. The high incidence in Europe can be attributed to genetic factors, diet, lifestyle, and, similar to the U.S., more frequent screening practices. In contrast, the incidence of prostate cancer in Africa is, on average, lower, but with a wide variation between regions. North African countries, such as Egypt and Morocco, have lower rates compared to southern and western African countries. However, in sub-Saharan African countries like Nigeria and South Africa, incidence and mortality rates are rising and concerning, although early detection is less common due to limited access to healthcare and screening. It is important to note that in African countries, cases tend to be diagnosed at more advanced stages, contributing to higher mortality rates. Globally, regions with the highest incidence of prostate cancer include North America, Western Europe, and Australia, while regions with lower incidence include Asia and Africa. However, as mentioned, mortality in some African countries is high due to late diagnosis. These statistics demonstrate the importance of considering regional factors in the approach to prostate cancer prevention and treatment. They also highlight disparities in access to healthcare, which directly affect incidence and mortality rates. These details will help contextualize the global incidence of prostate cancer and emphasize the regional differences. The symptoms of prostate cancer can be silent, especially in the early stages. However, it is important to be aware of signs such as difficulty urinating or the need to urinate frequently, especially at night, weak or interrupted urinary flow, blood in the urine or semen, pain when urinating or ejaculating, persistent pain in the back, hips, or pelvis. These symptoms are not exclusive to prostate cancer and may be associated with other conditions. Therefore, if you notice any of them, seek a doctor immediately. Early detection of prostate cancer can save lives. There are several important tests for diagnosis. Digital rectal exam. Although it may cause discomfort for some, it is a simple and quick test where the doctor checks for the presence of nodules or irregularities in the prostate. PSA, prostate-specific antigen, a blood test that measures PSA levels. Elevated levels may indicate the presence of cancer, but can also be caused by other conditions. Biopsy. If initial tests indicate abnormalities, a biopsy may be performed to confirm the diagnosis. A small sample of prostate tissue is taken and analyzed in a lab. These tests should be discussed with your doctor, especially if you are over 50 or have a family history of the disease. While it is not possible to completely prevent prostate cancer, certain habits can reduce the risk. Healthy diet. Studies suggest that a diet rich in fruits, vegetables, and whole foods can help. Avoiding processed foods high in saturated fats and sugars is essential. Beneficial foods. Tomatoes rich in lycopene, omega-3 rich fish like salmon, and soy may have a protective effect. Dietary supplements. Some supplements, such as selenium and vitamin E, have been studied, but their effects are still controversial. It is crucial to consult a doctor or nutritionist before starting any supplementation. Physical activity. Maintaining an active lifestyle is also crucial. Regular exercise can help control weight and improve overall health. Remember, these are general suggestions, and the guidance of a healthcare professional is indispensable for personalizing these recommendations. We emphasize that this video is informational in nature. Each person is unique, and what works for one may not be suitable for another. Therefore, it is essential to see a doctor regularly, especially for routine exams. A nutritionist can also help determine the best diet and supplements for you. Prostate cancer is a reality that affects millions of men worldwide, but with information and prevention, we can reduce the risks. Pay attention to your body's signals, adopt healthy habits, and don't forget to consult your doctor. Health is our most precious asset. Thank you for watching, and take care. If you enjoyed this video, don't forget to share it and help spread this important information. See you next time.